Do you suffer from the debilitating symptoms of chronic pain, swelling, and loss of joint motion due to arthritis? Are you taking drugs like Celebrex and Vioxx or other super aspirin prescriptions? If you are, you're increasing the risk of heart attack and stroke by up to 50%. This is Dr. Tom Roselle, host of Dr. Tom Roselle Live Sundays at 12 noon. Why live with pain or the dangerous side effects of drugs when the doctors at the Roselle Center for Healing, practicing 21st century integrative medicine, can help you experience relief like never before? Simple, safe, chiropractic, acupuncture, and nutritional care can provide significant relief from arthritic pain in less than 6 weeks. More than 70% of our patients experience a return to life far beyond their expectations. Give yourself the best gift possible, freedom from arthritic pain, naturally. Call today to schedule an appointment. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle live in studio. It's a beautiful day outside. It's absolutely stunning. Hopefully you're going to get a chance to get out there and go for a walk after you listen to Dr. Tom Roselle Live. I'm here waiting for you to take your phone calls at 888-630-9625. That's 888-630-9625. Let's talk about things that haven't worked so well for you. You've tried, you've applied, you've gone after the things that are bugging you, but guess what? You're stuck with them, and there is a why is that, so let's see if we can figure that out and point you in the direction that you need to go. You know, your health is a do-it-yourself program. Your health is one of those things that you have absolute control over. You know, the thought process of you are at an effect that it just happens to you is really not so much. You have, you know, those dirty old genes, you know, the genes that you're born from your parents and your grandparents and ancestry all the way through, and they pass through. But here's the deal. It takes something to activate them. It takes something to stir them up and to allow you to present, if you will, the symptom that's associated with the disease process, the dysfunction that ultimately shows up. So, you know, that's why we do this program. That's why we're here. That's why we do Dr. Tom Roselle Live for several decades now, and trying to look in between the trees, so to speak, and, you know, show you that you can change almost anything. And that's the truth, by the way. If you're listening to me, you can change virtually anything that's going on, modify it in some way, make it better. You don't have to look at the slippery slope that so many of you have embraced and said, well, you know, what do I expect for? And then you fill in the blank, because that's what Fifth Avenue Marketing has done. They've kind of put you in position. Listen, I want you to go to rosellecare.com, rosellecare.com, and you can do that website, or you can go to drtomroselle.com, drtomroselle.com, and sign up for the newsletter. It's free. It's to you. We try to give you as much data as we can. We send periodic important information to you. If you're not on our mailing list for, you know, really updated healthcare, personal attention advice, well, you know, here's an opportunity. Go do that, all right? rosellecare.com, rosellecare.com, or drtomroselle.com, drtomroselle.com, and check it out. And I think that you'll be happy that you did. Take a tour around. There's all kinds of learning pieces there for you, very interactive. Last week we were talking about chronic pain patterns, and Dr. Scott Lamp was my guest in studio, and he did a presentation last Wednesday evening on chronic pain, stuff that doesn't go away. And, you know, since we're on the pain bite here, I want to share something with you. We've touched upon it over time, and it got my attention because I was reading an article the other day, and I said to myself, how many people really don't understand the intimacies, if you will, the interplay between the structure, the chemical, the emotional paradigm. I want to talk to you a little bit about the biochemical piece as it relates to the cause effect, if you will, of low back pain. And there's a consistency of cardiovascular disease, you know, clogging of the arteries, inflammatory reactions of the arteries, and ultimately low back pain and low back disease. We talked about that, you know, a while back. And this is, you know, when things happen. It's like serendipitous. Sometimes patient asks a question, somebody else asks a question, then an article shows up. And I want to share that with you. There is tremendous amount of growing research and evidence that supports the thought process that if your cardiovascular system is all messed up, and you're going to have problems with your structural system as well. In a population-based Framingham cohort study, which is kind of the gold standard for looking at things, what they noted was advanced aortic hardening of the arteries, atherosclerosis, presented on X-ray and so forth. And what you would see is calcification, hard calcium deposits in the walls of the aorta. And what they said, this preceded the intervertebral disc degeneration of the disc, and subsequently low back pain. So let's follow this through again. So here's what I'm saying to you. That if you have cardiovascular disease, you're going to be predisposed to low back pain. Why? Because these arteries, that the major aorta, it's called the abdominal aorta, that comes down off the heart and supplies everything from the heart level down, has branches that go to soft tissue as well as organ systems. So if that's clogged up, then guess what happens? Those targets begin to fail. Now, we're talking about the disc spaces, the cushions in between the bones of your spine, and it's being suggested that this is a significant causative factor in disc degeneration or arthritis of the disc, or even fragmentation of the disc. There's another piece, and it's called smoking. Smoking will predispose to cardiovascular disease, and then it predisposes to low back pain. As you've heard me say many times, there are many surgeons out there who will refuse to do any kind of spinal surgery if the patient is a smoker, if they haven't stopped smoking for at least 30 days prior to the surgery, because they know the risk level is over the top. The results of this long-term follow-up, between disc disease and, by the way, what they wanted to call it was fatal ischemic heart disease. That means ischemic, not getting oxygen and so forth. Suggests very strongly that if you have hardening of the arteries, that you're going to have spinal disease. And most often, you're going to have low back pain at some point. And we're talking about pelvic pain, your pelvis as well as the lower back portion of your spine. The theory of low back pain due to this arterial degeneration came about some years ago. They started looking at it around the 1990s, kind of in that area. Seriously, I mean, they saw it before. And, they saw it on cadavers, dead people that they dissected in the labs. And they saw these degenerative discs that were associated almost tandemly with hardening of the arteries or arterial disease. And so they began to do other look-ats, if you will, and they saw stenosis, narrowing. Now, you can have stenosis of a disc, or you can have stenosis of an artery. It just means narrowing. It's closure. And when you have this closure, this narrowing, then you're going to have changes. You're either going to have loss of blood flow, or you're going to have something else, okay? So, heads up. If you know you've got cardiovascular disease, it's going to cause, ultimately, a predisposition very heavily leaning towards low back pain or some kind of other, as we've seen, spinal pain. And it really goes on. 888-630-9625. That's 888-630-9625. That's how you find me here in studio. I'd love to talk to you on any subject. We're talking a little bit about cardiovascular disease as it relates to structural pain. And as we go on the program today, I've got a couple other things that are in the news that I want to share with you. One has to do with a very important hormone that they're finding that when missing advances into things like Parkinson's disease, Huntington's chorea, even ALS, which is Lou Gehrig's disease, which is a wasting of the muscles, ultimately leading to respiratory distress, and the patient dies within a few years after it begins the process. It caught me by surprise. I didn't realize that there was that strong of a relationship. There were things that in literature that suggested it, but some of the things that are coming out now really make it much more heads up. We're going to talk about that, but let's get back and talk a little bit about the spinal blood supply. In the meantime, let's talk about your things too at 888-630-9625. So, they started reviewing the arterial blood supply to the spine, right? And, so as they went through all of this, what they saw was something called segmental arteries, and this is in the thorax. That's where your chest and your rib cage are, and the low back. And, they kind of looked at those, in the thoracic area, and those things that are coming off the aorta that we just talked about, that big, artery that supplies the lower portion. And, they're the primary blood supply, if you will, to the spinal column, particularly from the second vertebrae in your upper chest area all the way down to the last one in your low back. So these segmental, and that's what they're called, segmental arteries. So if you want to check it out, go ahead and do so. Segmental arteries, they come from the outside portion of the aorta, and they course to the back. Okay, they go to the posterior portion of the body. They go to the spine. They go to the soft tissue of the spine. So after going to these, the posterior aspect, they go to the bodies of the vertebrae. They supply the blood supply to your bones. And these segmental arteries divide up into a lot of branches, and they go one way and the other. And what they call something called the lateral branches supply the muscles of your back. So now we have blood supply to the muscles, and we have blood supply to the spine. So it goes from there that if that blood supply isn't working the way it's supposed to, guess what? Ultimately, you're going to get degenerative disease, you're going to get cord compression, you're going to get nerve compression, you're going to get pain. And this is what we've noticed with almost 40 years of practice. But now research is beginning to bear this out, that in fact, that this is true. And all these really sharp surgeons who say, I'm not doing surgery unless you quit smoking, Jack. There's a reason for that. And, it says that we have had our fingers in the mix here for a long time. We've talked about why arteries harden. We talked about why things begin to degenerate. And, I've tried to get you to understand that it's really because of the things that you do that cause that to occur, sometimes far more rapidly than even your predisposition should allow it to be. So here's the deal. We're talking about these arteries that come off the spine. We're talking about different things. The sacroiliac, which is, part of your pelvic structure, has huge numbers of vessels, that go around the area supplying all kinds of blood supply. So I want you to think about it again. Think about what happens if you don't get enough blood supply to any place in the body. I want to take that apart. I want to go through it a little bit of time, because there's a lot that you can do that makes a huge difference in how you handle this. You want to get rid of that back pain, you got to do more than just even mechanical things. Chiropractors are great, osteopaths are great, acupuncturists are great, but that is something that they're doing to you. You also have to take ownership in making sure that you change things. And we're going to talk about the blood supply and the acidity levels. We're going to talk about something called glycosaminoglycans, big word, right? And something called oligosaccharides. So we'll talk about that more importantly in a second. But in the meantime, Fred, how can I help you? Thank you for calling, sir.
Doctor, really love your program. Look forward to it every week. Set my schedule for it every week.
Well, thank you, sir.
I'm a little off topic with you today. I just found out from that my brother, who served in the Marine Corps in Vietnam for 2 years.
Semper Fi, buddy.
Had about 15 years ago had to quit his job, had to stop working because he started shaking so much. And I was wondering, his hands and feet started shaking. He was just unable to work. I was wondering if that could be Agent Orange related.
I was just going to ask you if he had ever been exposed to that while he was over there. All right, so the short answer is yes. It could very much be that. It's a highly toxic substance that is known to cause neurological impairment of degeneration. Ultimately, what happens is the body can't, with other toxins building up over pretty years. See, all these guys, the Vietnam years, I remember when I was down in Quantico and I went for my first summer boot camp, I got 2 Navy corpsmen on either side, and they had these air guns on either side of my shoulders, and I'm getting blasted with a bunch of vaccines, and then, one in my tail end. And, so all these toxins are in the system. Now you have that compounded with Agent Orange and some other things. Fred, I want you to hold on because I want to talk about that for about 30 seconds more or so and give you a little bit more data. So don't go away. We're coming up to a break because it's a really important situation. There's so many of our servicemen find themselves in really bad places and sometimes don't know why. We're coming up to a break. You're listening to Dr. Tom Roselle Live. Don't go away. You've been everywhere, you've done everything, and you still feel like, well, Did you know that your health and wellness starts with your brain and nervous system? What if by establishing normal brain and nervous system function, you could regain your energy, strength, and vitality? Would you be interested? I'm Dr. Tom Roselle, host of Dr. Tom Roselle Live. Join me and an elite group of wellness practitioners for Ageless Health 2015 on October 17th at Fairview Park Marriott Hotel in Falls Church, Virginia, for a day that could change your life forever. A day when you'll learn step by step how to create a brain-body connection that will allow you to live in a state of wellness that you deserve. Register today at agelesshealth2015.com. That's agelesshealth2015.com. Or call 703-698-7117. Register today. After all, your health is a do-it-yourself program. Welcome back, everybody. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live in studio, 888-630-9625. That's how you find me, and we talk here. Or you go to drtomroselle.com. That's drtomroselle.com. And we can go back and forth on email. But either way, let's handle your problems, and let's see what we can do to help you out. Fred, you still there?
Yes, sir. And before you end the conversation, may I ask a follow-up question?
Sure, go ahead.
You started to talk about toxins. My brother started smoking afterwards, and I would expect that would have an additive effect. And I had a question as to whether it could be early onset Parkinson's.
It's possible. Parkinson's, is a neurological degenerative disease. It has to do with the amyloid formation in the body, just like so many other things like Alzheimer's and ALS and so forth. But here's the situation. When you have high levels of toxin in the body's trying to fight to get rid of all this stuff. But when it's overburdened, it can't do it. It has to do it through the lymphoidal system, and it dumps it. But liver processing is also critical. The liver is your primary filter in the body, and when that gets overwrought for many different reasons, we just talked a little bit about smoking and how it impairs cardiovascular flow and so forth, and it causes hardening the arteries, and you add that to other things. Like I said, these guys that went to Vietnam, they had tons of things put in their body to try to prevent them. They were exposed to fungus.
Yeah, I did 2 tours there. I'm familiar with the needles.
So you got it. I mean, it was the things, and I've seen over my career, I've seen huge numbers of guys that served in Vietnam that came back with all kinds of things. So you go to a study in 1994 that was, actually quite revealing in my mind, and it was the Neurological Health Outcomes and Agent Orange Institute of Medicine report. And I'm not going to get into it completely, but what it says, and here's one of the reasons that we don't know a lot about a lot of things. Now, the report goes on and shows in the research, if you really do the backup, this was a PubMed indexed report. But it says the committee that evaluated the findings, and they were, by the way, very significant in saying that a lot of these guys suffered dramatically because of their exposures. And I'm going to quote this. The committee concluded that the available evidence was insufficient to determine an association between neurologic disorders and exposure to herbicides used in Vietnam, i.e. Agent Orange, right? So they're covering their back end, because if they admit to this stuff, do you realize the lawsuits that can come about over a period of time, and also the financial hook?
I'll tell you right now that the VA has conclusively presumed that ALS is, if a vet shows up with ALS, they're conclusively presumed to have been, and they've been exposed to Agent Orange.
Yep, I agree with you. I mean, this was a report that was done in '94. Now, because of a lot of other underlying pressure and things that are being published, they're not going to do it publicly. But if you present, you're going to see it. The information's there, the literature's there. Absolutely, Fred. And so could it be? Yes, absolutely could be. It could be a predisposition to Parkinson's. It could be, they could diagnose them initially as having intention tremor, a benign intention tremor, just because they're not digging too far. But my guess is, as you go through, and if you did some functional medicine tests, you're going to find high levels of a lot of different things, including toxic metals, which were in many of these vaccines that they were giving at the time. And Agent Orange by itself is a degenerative substance that causes this, and ultimately whether it's a patient with ALS or whether it's a patient with MS and so forth, I've seen too much of it over the years. Just from our anecdotal point of view, a clinical application, absolutely, and there's things that can be done.
I'm trying to get him to go to the vet, and he says that it's not related, that it's because of his smoking, but I'm trying to get him to go to the Veterans Hospital. Would you say that I ought to kick him in the posterior and get him to go there?
He needs to see somebody who can do something about it. Unfortunately, in my opinion, the traditional allopathic community and government intervention doesn't have the capacity, first to admit that that's actually what the situation is, but to do something about it.
What kind of physician should I send him to?
You're gonna need to see somebody who does functional medicine intervention that knows actually how to look at the heavy metals and be able to do things with that and to treat the nervous system, and combines integrative methods. We do that work. There's guys in all over the area that do that. Fred, send me a note, offline at drtomroselle.com, and I will give you my straight up and who I would see and what I would do. Okay?
Doctor, may I put in the subject line? I'll put VA Agent Orange, so you'll know it's me.
Yep, I'll see it. I'll open it, and you'll hear back from me.
Thank you very much,
Fred.
Doctor.
Thank you very much. Appreciate your phone call. 888-630-9625. We have several calls online. We will get to you. We're coming up to a break. Important program today. We have a lot of things to share with you, things that I want you to know about. When we come back, I'm also going to talk to you a little bit about Ageless Health 2015, brain-body function. This is very apropos at this time, something that none of you should miss. This is a home run for you to take information home and really change your lives. Don't go away. This is Dr. Tom Roselle.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back, everybody. Dr. Tom Roselle here. Welcome to a beautiful Washington day. I mean, it is really lovely outside. Hopefully you get a chance to get outside and play a little bit after we finish the program, not before. Or if you happen to be outside, you're listening in the car, don't get out of the car. We have to cover some very important things for you today. We're here at 888-630-9625. That's 888-630-9625. Listen, I want to tell you something. October 17th, Saturday, Ageless Health 2015. You need to be there. This is a day that is going to give you so much power-packed information about your brain and your body and how the neurological system works, what you can do to enhance it, to save your life in so many situations. Trust me, this is a home run. This is probably the best program that we've ever produced, and we're year number 15 of doing this. Join us. I really would like to have you there. All you need to do is go to agelesshealth2015.com and check it out. You can go to the Roselle Care website as well, rosellecare.com. Check it out there. We have it in a lot of different places. And here's the deal. You only have a couple more days to save money. Today is the 26th. At the end of the month, end of July, the pre-seminar discounts go away. So if you would like to save some money, do it now. Don't waste any more time. You've got to be at this seminar. You've got to be at this class. You have to be at this conference. Call it what you want. It's a day of impactful learning. It's one that I promise you will be over the top. Far more information than you can possibly expect. You'll be our guest. We're going to feed you. We're going to make sure that you go away with the ability to apply the information. Yeah, we're going to feed you an organic lunch, and we have things for you when you walk in to register, and we have breaks and so forth. Trust me, if you've never been to one of these before, we change the information every year. This is by far the best we've ever done. AgelessHealth2015.com. Do it today. Don't waste any more time. Go save some money. Jane, thank you for holding and paying attention. How can I help you?
Hi, Dr. Roselle. How are you?
I am great, my friend. How about you?
Well, I am absolutely fabulous. I am 65, and I decided to take charge of my own health and start exercising. I had some pretty bad health numbers, and I was have become a group certified fitness instructor.
Good for you. Congratulations.
Lost 40 pounds.
That's even better.
Reversed my osteoporosis. Got my heart rate down so that it was pre-hypertensive, and now it is absolutely perfect. But my biggest problem is when you lose 40 pounds at 65, you have a lot of loose skin.
Yeah, it doesn't respond back like it used to, does it?
No, it does not.
So you and I are both at that same place in life, so I understand your pain.
And so I'm trying to figure out the right protein load and strength training load. And the research is telling me I need to add 100 grams to the 44 that would be standard for optimal for a woman of my age. But what kind of protein?
Okay, so let's play with that a little bit. First of all, whoever told you 44 grams is lying to you. The amount of protein that you need when you're young and the amount of protein that you need when you're older has to be extremely high, because when you're young, you're adding muscle and growing. When you're older, you're breaking it down and degenerating. So you want to stop that, and you want to enhance the former. So the thing of it is that with your training that you want to do at any stage in life, you want to do strength training, not just light toning. I mean, any kind of exercise is better than no exercise, but the more stress intermittently that you can put on your muscles and bones, the more they're going to respond, the more testosterone you're going to produce, growth hormone will be stimulated. You can recover a lot of things, but you want to make sure that the body also is working properly where you can process these things. So here's a situation when it comes to protein. You know, people say, well, if you want to get protein, you eat egg protein. And egg protein is actually a pretty good substance, but it's not efficient. Somewhere between 48 to 50% efficiency as far as absorption of the protein in it. When it comes to meat and fish, unless your digestive enzymes are good, and as we get older, you know, by the time we're at the age, you know, plus 60, you produce about 30% of the stomach acid that you did when you were 25 years old. So you're not going to break the proteins down the way you should. Soy, forget about it. I mean, as far as I'm concerned, throw it out the door. It's not effective. It's not efficient. And then there's these things called branched chain amino acids, which you have to have with all these things. You have to have adequate amounts of digestive enzymes to make it work. So you have to do things that are qualitative. So when my patients present with certain challenges and they want to deal with bone density, they want to add muscle mass, they want to, you know, we're dealing with collagen as well, and, you know, as we get older, you know, I usually don't recommend a product on air because they're not paying for the show. But this one is, I love this product. I mean, this is something that, you know, works really, really well. It's called Perfect Amino. And what it is, it's an amino acid supplementation that contains the 8 essential amino acids. And it adds to the support of your structural system, your enzyme productions, your hormone system, and so forth. And the reason why I like it so much is that all the studies that I've been able to find, all the reviews that I've looked at, indicate that you have somewhere around 98 to 99% absorption, and it bypasses liver function. It doesn't have to be metabolized. And that's where you get into some of the problems, is that most proteins, if they're too excessive, cause first the residue. If you're getting animal proteins and so forth and you don't have enough digestive enzymes to work on it, they're going to rot in your intestinal system. But this, these amino acids bypass the whole digestive process, so to speak. I'm going to use that just kind of, broad brush. It works extremely, extremely well. Patients who have had surgeries, who need a lot more protein to heal with, patients who are emaciated, it works far better than anything that I've seen. Plus, it increases the body's ability, the liver, to say, its ability to detoxify and, handle things. So for bone density, for muscle growth, and so forth, I would first make sure that you're getting enough protein in your dietary patterns. You're getting enough digestive enzymes. Your intestinal system is working the way it's supposed to. But when you're working out particularly, I would get something like this. You can go online and check it out. It's really...
Yeah, definitely. That sounds like a perfect plan, because I'm out an hour every day. I use a fusion mix of dance because it's the perfect arc of exercise. I use light weights every other day and resistance training at home every other night. with a particular load of weight.
Yeah. Now, listen, when you go and you check this thing out, understand something, that this is the only product that this company makes that I support. And we have a lot of experience with it in our office. It's, again, if you have any health problems, you really need to make sure that even with this or anything else that you kind of bypass the person that's working with you. But this is one that I take and works really well, and I put a lot of patience on it. We use it in our practice. The old name, this is a conversion of a product that used to be called MAP, M-A-P. And a lot of the high productive athletes used to use that, but they switched it out. The company was bought and so forth, but it's essentially the same product. Anyway, Jane, I hope that helps a lot. And
it does. Thank you very much.
Anytime that I can help you, send me an email and we'll talk. 888-630-9625. Bill, how can I help you, sir?
Yes, good afternoon.
Good afternoon.
Thank you for your show.
Thank you very much for listening.
I suffer from severe anxiety and PTSD.
Okay.
And I got a horrible panic attack in my sleep last Saturday, early in the morning. And after that, I began having dizzy spells that lasted for a few days. It only happens in the morning, and during the day it subsides. It goes away.
There's a lot that can be done with this. I'm looking for something for you right now. I had, about a year ago, I had Dr. Stephen Zadkoy as a guest on my program. Stephen is working with the United States Marine Corps in a project treating PTSD, and he's doing it with a technique called neuroemotional technique and doing support mechanisms to adrenal support and so forth. It's a combination of things that their effectiveness is over the top. And what's happening is that not only are they getting guys to be able to handle their lives again, but many of the guys that came back from overseas that are profoundly suffering with PTSD symptoms, they're actually getting them back in their units. So what I would tell you to do is one of two things. Either look up Dr. Stephen Zadkoy, or send me a note at drtomroselle.com, and I will refer you to his, to his office's website, and then he will tell you who's working with him in the study. If it's a PTSD problem, that's the best way to go. So I'll do everything I can to help you, Bill, and that truly would maybe open a door to you.
Meanwhile, why is there still occurring just in the morning?
It can happen because of a lot of reasons. If you were a patient of mine, I'd be looking at the acupuncture clock. I'd be looking at your cortisol levels, which peak in the morning.
Yes.
If your cortisol gets way too high because you're working things out in your sleep, what happens? Yes. High cortisol will make you very, very agitated and very upset. If your blood sugars are not stable during the nighttime, one of the primary symptoms associated with blood sugar irregularity is anxiety and the dizziness. The dizziness walking around generally is adrenal support because of the hormone angiotensin, which helps stabilize all that. There's so many things that are involved in this. You look at the acupuncture channel that is the highest, that's intestinal tract when you wake up, intestinal stomach. So if there's things there, that can cause a problem. But you look at hormones, you look at blood sugar handling, you look at the energetic system, and then you handle those things. And if those are part of it, then you modify the symptoms dramatically. So, Bill, I hope that helps. Get a hold of me.
Right. I'll send you a note, and I'll put PTSD in the subject line.
Fine. I will respond to you. Thank you for calling, Bill. I appreciate it very much. 888-630-9625. That's 888-630-9625. The study that Dr. Stephen Zadkoy is doing with the United States Marine Corps is significant. It went into 2 different phases, and the results that they're getting are over the top. They're amazing. We do a lot of work with our patients. We have many patients who suffer from PTSD, and we work with them neurologically because there's a neurological impact. We work with them biochemically, and we look at them from an energetic point of view. The reason we're able to do that is we're a practice that looks at and treats people from multiple platforms, from biofunctional medicine platform, from an acupuncture energetic platform and Chinese medicine platform, and from neurological chiropractic platform and functional neurology. If we can help and simply in referring, we're glad to do that. Amanda, thank you for calling and thank you for being patient. How can I help you?
Hi, I have a granddaughter who has Lyme, and because it shows up as a arthritic condition, they're taking her to arthritis, they're giving her injections, and she's getting thinner and thinner. Her legs are like sticks. She's only 11.
How long has she been truly diagnosed with Lyme's, or are they guessing?
Yeah, she was, and Bartonella and some other things, but the mother did not want to pay out-of-pocket expenses at a Lyme doctor, so
that's the problem.
Decided she had arthritis.
Yeah, no, that's the problem. What they're doing is you don't treat the arthritis, you treat the patient, the immune system, the Lyme's, and so forth. They'll make her worse over time because the medications that they're going to give her are awful. They're very degenerative. Now, if with Lyme's, as you know, there's a biofilm that it protects the bacterium, and there's many cofactors that are associated with it. There's things that can be done, but you're going to have to go outside the traditional allopathic community because all they're going to do is they'll put ports in, they're going to put antibiotics through the ports, and that's really the only way that they can do that. There's procedures out there, things called biophotonics. They do most of it overseas than they do in this country. Amanda, listen, I will give you the referrals. I will tell you who to call, but the way she's approaching this is not okay. It's going to make life much worse for this child. I'm sitting here talking to you, I'm getting irritated, and it's not okay. Go to drtomroselle.com, send me a note, and I will send you the information that you need to know and how you follow up on this. I appreciate your phone call. We're coming up to a break. You're listening to Dr. Tom Roselle Live. I have a few more things I really need to share with you, so don't go away. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a Do-It-Yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
105.9 FM and AM 630 WMAL.
Welcome back, everybody. Dr. Tom Roselle. You've been listening to Dr. Tom Roselle live, as you do every Sunday. Same old time, same old place. And make sure you tell your friends about it because I try to bring you as much information as I can. Remember what I've told you? I said, I've done my job if I can provoke you into doing your own research. Don't believe anything you hear from anybody and half the things that you see, because there's always a twist. And even question the things that I say to you. Make sure you go out there and you do what you need to do and check it out. That's your responsibility. That's about you. I'll help you weed through the woods a little bit, but you need to do your own stuff. I want to touch a little bit more on I'm going to set aside something for a minute. I want to touch a little bit more on our last caller. And Lyme's is devastating. It's affecting more and more people. And by the way, those of you who don't know, it is transferable from one person to the other through body fluids, through intercourse, and so forth. If you have it, you can give it to somebody. And it's just one of those things. It's out there. They don't like to tell you that, but that's the truth. It's treated with antibiotics, mostly doxycycline. If they can get to it very quickly within the first several days of exposure, then you know that it's Lyme's. You can pretty much get rid of it. And it's for at least a 30-plus day course. If they can't do it, they go back. They do ports, and they do amoxicillin in the port. What I mean is that they put a permanent tube in because they don't know how long it's going to take to treat you, and they keep hitting you with antibiotics. So the thing that is that once it gets to a place where, and if you go into the different website, they're going to talk about this neurologically presenting side effect of Lyme's, and they're calling it an arthritic or neurodegenerative changes and neurofibrosis or neuroborreliosis, which is one of the bacterium that has to do with Lyme's. The thing that is they don't really know how to treat this. So the Arthritic Foundation is getting involved, and they're saying, well, you have this leftover problem with the joint spaces. No, what we've seen, and a lot of the literature holds out, and if you go through and you really, really look at the literature, you're going to see that this is the end sequela of somebody having it. But what they're suggesting also, particularly overseas, is that this is the bug's still there. The biofilm is formed and it still flares up. You have an inflammatory response. Immune system has been degraded, has been broken down, and we could spend and get into the different markers and so forth. But what I want you to know is that really when you look at things, look across the board to try to find out everything that's being published. And then, as I read that last article to you, when you have a body of information that has significant yes, and then you have a review board that says, well, it's not conclusive, that should be a flag to you and say something's not right. Something's not right here. And do that with a sense of understanding that everybody has an agenda. When you want to find out if something's true or not, when you read an article, there's several filtering things that you need to go through. One, ask who wrote the article, find out who their attachments are, what did they have to gain by writing the article, and the third is who paid for it. When you can answer those questions, it leads you through certain pathways that ultimately ends with a conclusion that maybe you didn't expect to begin with. I've become very skeptical after almost 40 years of practice, and a little bit of tongue-in-cheek sometimes when it comes to reviewing articles, and that's just the way it is. My primary consideration and concern is you. That's why I continue doing what I do. I want you to understand that you have the capacity really to make a difference. Question everybody that you see. Don't sit back and say yes sir, yes ma'am, and just do what they tell you to do. Unfortunately, that was an attitude decades ago that the white tower doctor was the know-all. It's not necessarily the case. You have to, an engineer understands systems. Unfortunately, most medical physicians don't. It doesn't mean that they're not smart people. It doesn't mean that they don't have the mental capacity to assimilate information. It's the thought process. Overseas, when you go to Europe, they're doing things very differently. There's something called biophotonics that they use overseas, and it's how they handle processes like Lyme's and other situations of that nature. Our hands are tied sometimes, and when you get somebody who really knows their stuff, sometimes they go after them in ways that are unmentionable, but I'll let you draw your own conclusions. Go to our website, go to drtomroselle.com and check it out. It'll lead you into a lot of different places. Hook in, check out our newsletter. It's free to you. It's our gift. We want you to be able to be educated. Attend our in-house continuing education programs at the Roselle Center for Healing. We do them every other week, always on a different topic. And don't forget, Ageless Health, 2015 coming up in October. Please be there with us. I'd love to have you there, and I promise you a day you'll never, never, never forget. We're coming up to a way too short end of our program. I'll see you next week, same time, same place. God love you. See you later. Bye.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.